First of all, I would like to ask you for your permission to put this video on internet for educational purpose. Do I have your permission?
Yes, I give you your permission.
Okay. Now, I would like to ask you, you had back pain and pain going down the leg. And can you tell me, for how long had you have those symptoms before the surgery?
I'd say I'd had them for at least a couple of years.
Couple of years. And 1 to 10, how bad was the pain when it was really bad?
Right before like a couple months before the surgery, it got to be a 10.
10.
It got really bad.
And we tried all the non-surgical treatment. They weren't helping
Right.
you. And we pressurized the disc as well. And we showed that 2 of the lower discs were in a bad shape. And then we did the surgery about 8 or 9 months ago. Is that correct?
It was done on July 8th.
Now tell me about, first of all, how long did you stay in the hospital and how did the surgery go?
I just stayed in the hospital overnight. I didn't have any pain down my right leg.
So the pain in the leg was gone right after the surgery?
Right after the surgery.
And
I
you
was up walking that afternoon.
Excellent. Now, and then you went home, and how long did it take you to go back to your usual daily activities?
I was off work for, well, we were scheduled to be off work for 4 weeks, but we had a lot going on that last week, so I took an extra week.
Okay.
So I was off work for 5 weeks.
Okay, but generally you were back to your usual previous life within a month or so.
Oh, yeah.
Okay. Now, and obviously we are going through a healing process, and I'm going to swing to the pictures here and describe it and talk to you about that.
Mm-hmm.
And here we see that, first of all, in the back, we did a surgery between the 4th and 5th and the 5th and the S1. These are 2 discs we addressed. And we see in the back the bone is growing properly. Now I'm going to go to the front where we put those spacers in. And we see that as well, that the white, which is bone from one bone to another, the bone is growing properly. And it obviously have to get a little stronger. Usually 9 months is not enough. It takes longer for it to get stronger. And I'm going to put now the 3D view of it. When we turn, you see your ribs up here, your pelvis down here, and the screws that are going in. So practically we achieve with a minimal invasive technique the removal of the bad disc, and then we put the discs spacers and then internally stabilize it. The fusion is done, but not as strong as it can be maybe in another 6 months.
Okay.
Now, I understand you have as well some other pain that we think maybe your SI joint is as well the problem. Now, but that need to be addressed later on. Now, overall, what would you say after the surgery? How much of your pain was gone? How many what percentage of your pain was gone after the surgery?
Well, the pain going down my leg was totally gone.
Okay. And
right away when I woke up from surgery, it was
okay.
gone.
And the back pain right after the surgery, within the next 2 months after the surgery, how much of the back pain was gone?
Oh, I bet at least 75% of it.
Okay, and so the healing is an ongoing thing. Well, this is a common theme that we see. The back pain, slowly goes away, and the leg pain is goes faster than the back pain. But thank you very much for your experience, sharing it with